Hello everybody, we are here to discuss the adaptation of therapeutic diets. So initially we will be discussing what is the meaning of therapeutic diets. So we go into definition now. So therapeutic diets are adaptations of normal or regular diets. In other words, it is a diet for a patient suffering from a specific disease such as heart failure, hypertension, renal failure, diabetes, etc. Okay, the disease process also influences both the quality and quantity of the diet. The other aspects that may require changes include meal frequency, etc. Next, we discuss is why do we require a therapeutic dietary adaptation. Okay, so here it is given point wise. The number one is to maintain or restore the optimum nutritional status. Number two is to provide rest or relieve an affected organ, example via giving soft or liquid in gastritis. Number three is to adjust the body ability to digest, absorb, metabolize, or excrete. Giving low fat diet for fat malabsorption. Number 4, to adjust to tolerate food intake by mouth, example tube feeding or patients with cancer or esophagus, because they in such condition patient cannot be taking oral intake of the food. Number 5 is to adjust mechanical difficulties, example soft diet for patient with dental problems. And number 6 is to increase or decrease body weight or body composition by giving high calorie or low calorie diet. So the 6 points that we have discussed is why the patient is being given a therapeutic diet. So it can be due to the nutritional changes of the nutritional status changes of the body. Okay, the nutritional requirement of the patient body can change, and next is because the patient might be having some problem with the oral intake. And also discuss the patient can also be having problem with his or her body weight. So these are the purposes why a therapeutic dietary adaptation is required. Next, we move on to types of dietary adaptation for therapeutic method. The dietary adaptations for therapeutic needs are changes in consistency of food such as liquid diet, soft diet, low fiber diet and high fiber diet. Increase or decrease in energy value of the diet such as low calorie diet for weight reduction and high calorie diet for burns, etc. Changes in specific nutrients such as sodium restricted diet, lactose restricted diet, high fiber diet, high potassium diet. Elimination of spices and condiments such as in bland diet, omission of specific foods such as allergy diets, gluten-free diet, and last but not the least, adjustment in the ratio and balance of protein, fat, carbohydrates such as diabetic diet, ketogenic diet, renal diet, cholesterol lowering diets. So these that we have discussed are the dietary adaptation for a therapeutic needs. Means how can you make a normal diet into a therapeutically needed diet. Okay, so next moving on to types of dietary adaptations for therapeutic needs in case of diabetic and post gastrectomy diet or peptic ulcer disease. As we all know that this kind of diseases will require limited moderate amount of energy, but also small frequent meals, because the patient here we cannot be feeding the patient much at a time. So small frequent meals is supposed to be given to a patient with such conditions. And secondly is test diets, as these are single meals or diet lasting one or few days that are given to the patient in connection with certain tests. For example, fat absorption tests used to determine if steatoa is present or not. So here which means is that if the patient is suffering from steatoa or not, certain type of diet is given as a test diet in order to find out whether the person is suffering from any fat absorption problem or not in the body, due to which the steatoa persists. Okay, and last is the change in feeding intervals, that is meal frequency. Okay, diet prescription. Now, in order to implement a therapeutic diet, we require a diet prescription. The diet prescription designates the type, amount, frequency of feeding based on an individual disease process and disease management goals. The disease may require a calorie level or other restriction to be implemented. It may also limit or increase various components of the diet such as carbohydrate, protein, fat, vitamins, minerals, fibers, phytonutrients, or water. Another aspect which the diet prescription takes in account includes the economic status, food habits, food intolerance, allergy, occupation, and meal timings. These are all patient specific. Okay, when the patient gets admitted to a hospital, we have to do a 24-hour dietary recall, which includes all these 5 criterias, and also we have to check on during this process we check on the economic status of the patient, food habits of the patient, food tolerance, food allergy, and occupation and meal timings, so that we will be able to give a simple kind of food to the patient according to his or her requirement. So next slide is how we assess the nutrient intake for assessment of nutrients intake. Now, an individual energy requirements can be determined by calculating either the required number of kilocalorie per kg per day or the percentage increase over basal metabolic demands. We can also, you can estimate the basal energy expenditure BEE from anthropometric data using the following Harris-Benedict formula. Okay, we all know, we have already discussed what is the Harris-Benedict formula. So as you can see, the calculation and the formula has been given out here. So the last point is important, which says the acute infection or burns may require 100% over basal, which in other terms means that a burn patient may require a high calorie amount compared to the sedentary or the normal energy intake. To burn patient, we might be giving more of the calorie to the patient. Okay, now again we go into assessment of nutrient intake. For example, carbohydrate. Okay, the carbohydrate provides bulk energy to the diet, and along with fats, they are actually comparatively inexpensive form of the carbohydrate. In a high calorie diet can include chapatis, bread, biscuits. In a low calorie diet, this must be used sparingly. As we all know that carbohydrate and protein liberate 1 kilocalorie per 1 gram. Okay, and fat is the nutrient releasing 9 kilocalories per gram. So what we do is, in most of the diets, carbohydrate is the nutrient which is giving the maximum of the energy. So we try to provide that in bulk because it is providing the bulk energy. Then we move to protein. Once the energy requirement have been established, protein requirement is to be addressed. The aim is to achieve nitrogen balance. Always it is essential to achieve the nitrogen balance, so that the branching amino acids that is being provided in the diet should be readily absorbed, okay, and effective in building the muscles and tissues of the body. Now, the aim is to achieve nitrogen balance. There are several factors influencing protein requirement, and these include total energy intake, the metabolic state of the patient, and protein losses. However, it is important to keep in mind that protein synthesis requires energy. The RDA for protein is 0.8 to 1.0 gram per kg body weight for adults. The actual minimum amount of protein needed to maintain nitrogen balance in healthy adults is 0.5 gram per kg. The requirement varies with specific disease status. Example, larger amounts of protein is required for severe protein wasting such as enteropathy or extensive drainage from wounds and fistula and also burns. Okay, protein should be restricted for those patients who are suffering from acute renal failure or hepatic insufficiency. Now moving to fats, yeah, we are already aware that fats are reservoir of calories because 1 gram of fat is giving you 9 kilocalories. Okay, in addition to carbohydrate, fat can also be an important source of needed calories. In certain therapeutic condition, fat is necessary to prevent essential fatty acid deficiency. A high calorie diet should contain fatty foods such as cream, butter, ghee, oil, while a low calorie diet contains a little or no fat. Now again coming to the point that there are two types of fat, visible fat and non-visible fat. So we should always be attempting to limit the amount of visible fat that is going in the diet for a patient. Okay. Patients requiring low animal fat diets must restrict their total fat consumption less than 30% of their total energy need, and ideally 2:3 ratio of this must be in the form of PUFA, which is known as the polyunsaturated fatty acid, and MUFA, which is known as the monosaturated fatty acid. This can be achieved by avoiding foods that are rich in saturated fatty acids. Saturated fatty acids are examples of hydrogenated oil, or you know, vanaspati and all those things like dalda, and these are all your saturated fatty acids. Such a here is given as all fried meats and fish, whole milk, cream, cheese and butter, etc. While food products such as poultry, fish, egg white, cottage cheese, skim milk, wholemeal cereals, fruits, vegetables, wholemeal bread can be taken in liberation or under the supervision of the dietitian. So you can sum up that the ideal ratio required to go into the diet for the fat is 2:3 of PUFA and MUFA, and where MUFA and saturated fatty acid, which examples I've already given you, which are known as vanaspati, dalda, okay, this butter and ghee, whatever these are, they should be like completely avoided in the diet. Now we move on to sodium and potassium. They are a very essential minerals to our body. The recommended dietary intake of sodium is 2300 milligram per day, and that of potassium is 2300 milligram to 3400 milligram per day respectively. For pregnant and lactating mother, the potassium limit will increase up to 4700 milligram per day. Okay, now let us discuss what will happen if there is lack of sodium in the body. Lack of sodium leads to hyponatremia, okay, which is again the amount of sodium in the blood or in the serum. And potassium, the lack of potassium in your body leads to hypokalemia, okay, which is not a very favorable thing, because when you are suffering from such deficiency in the body, you may be suffering from palpitation and dyselectrolytemia, lack of healing. You may be confused, nausea, headache. These are which will result. These are what results to these are the result of your hypokalemia and hyponatremia. So in order to avoid that, we try to maintain the recommended dietary intake of sodium and potassium in the body. Foods containing high sodium, such as processed and cured meats, tinned and smoked fish, tinned vegetables and soups, dehydrated and pre-packed meals, pickles, salted biscuits, nuts, they should be avoided. Okay. Because if there is more amount of salt intake, then it has been shown that it leads to high your heart problems. Where if you have more amount of salt intake, then you have an adverse effect, blood pressure and increased heart disease risk. Next, now potassium. You know, the potassium restricted diets are important for patients with advanced renal failure undergoing conservative treatment or hemodialysis. The high potassium levels, mushroom, spinach, tomatoes, dry and spilled peas, lentils, fruits, etc., prunes, dates, currants, grapefruit, oranges, banana, etc., must be avoided when you are suffering from hyperkalemia. Vegetables should not be eaten raw. They require leaching before consumption. The patients must also be aware and warned against using salt substitute. Going on to fluid allowances, you can see that during certain clinical conditions such as renal failure and also in case of ascites, you may say, when the fluid intake can be determined to the prognosis of the disease, the fluid allowance is calculated by the formula which you can see on your screen. So that is the formula which regulates the fluid allowance of the patient. Okay, to like how much we should be giving to the patient, how much fluid we should be giving to the patient, and it is per day. It has to be calculated per day, like 1 liter per day or 1.5 liter per day or something like that. Next we have types of therapeutic diets. Now there are these are the various types of therapeutic diets. First comes regular diet, liquid diet, soft diet, diabetic diet, calorie control diet, low cholesterol diet, fat restricted or low fat diet, sodium restricted diet, protein diet, bland diet, and low residue diet. Okay. So the next slide will discuss in brief about the diets, about the therapeutic diets. So first comes your regular diet. When the regular diet, these are balanced diet usually used for ambulatory patients. Ambulatory patients means normal patients who are not bedridden. Okay, at times it has a slightly reduced calorie content. Foods such as rich dessert, cream sauces, salad dressings, and fried foods may be decreased or omitted in a regular diet. So basically, regular diet means the normal diet which we eat in our day-to-day life. Okay, but in such regular diets, you may restrict some rich dessert, which means like mishti and all those things, and cream sauces, like less amount of sauces, and salad dressing, basically not using mayonnaise or anything like that. And fried foods should be omitted, or it should be used in less amount. Okay, next we go to liquid diets. Liquid diets, nutritionally, liquid diets are nutritionally inadequate, and they should be used for a shorter periods of time. It's like the uses of liquid diet implies after surgery or a heart attack, because basically when the patient is taken out from a surgery, or if a person has had a heart attack, they may not be able to eat solid diet or soft diet, so liquid diets are prescribed. Second is a patient with acute infection or digestive problems. Again, they might not be able to digest these solid foods that have been given to them, but it is also required for them to full their make they feel that the stomach is full or something like that, so the liquid diets are given. Okay, and 3 is to replace fluid loss by vomiting or diarrhea. So as we all know, during vomiting or diarrhea, lots of body fluid is lost. So we replace this loss by adding extra liquids in the diet of the patient. And lastly is before some x-rays of digestive tract, or USG, which is also known as ultrasonography, we provide liquid diets to the patient. It says here that there are 2 types of liquid diets. One is your clear liquid diet, and second is your full liquid diet. Clear liquid diet means examples, as you can see from the examples given: water, apple, grape juice, fat-free broths, plain gelatin, popsicles, ginger ale, tea, coffee. It means that the diet here, or the liquid here, needs to be very clear in nature. Okay, they should not be containing any strained soups or anything like that, or smoothies or anything like that. So that is your clear liquid diet. And second is your full liquid diet, which means everything on clear liquid diet, plus it can contain your strained soups and cereals, fruits, vegetable juices, yogurts, hot cocoa, custard, ice cream, pudding, sherbet, and eggnog, and also your smoothies. Okay, these full liquid diet, they also contain a part of the food. So the fullness is provided in the full liquid diet, as because they contain a part of the food, and hence the carbohydrate and all sort of essential calories and proteins, minerals are also provided as a part of the diet. Next, we move on to soft diet. They are similar to regular diet, but food must require little chewing and be easy to digest. The example that we used for soft diet was patient with suffering with dental problems, as we have discussed earlier. So what are the foods that are to be avoided in a soft diet? Fried foods and nuts are not to be given in a soft diet. Rich pastries and dessert, raw vegetables, heavily spiced foods, gas forming vegetables, skin and seeds of vegetables and fruits are not given in your soft diet. So your soft diet consists of everything: carbohydrate, protein, fat, uh, according to your RDI, and it is the type of food that is given to the patient which is in your soft form. For example, in Bengali you have this gola bhat. Okay, it is a type of soft diet, and in English we call it porridge. Okay, so and vegetables which have their uh, linings peeled, okay, the outer skin peeled. For example, you can give vegetables such as gourd. Vegetables are uh, favorable to give in your soft diet. So now moving to your diabetic diets. Diabetic diets are used for patients with diabetes mellitus, because the body does not produce enough insulin to metabolize the carbohydrates. The diet contains exchange list. Goods are grouped according to type, nutrients, and calories. Patients are allowed a certain number of items from exchange list according to your individual needs. As we all know that diabetes is a condition when enough insulin is not produced in your body to counter the glucose liberated by the carbohydrates. So now what we can do is we can in this diet we have to limit the amount of carbohydrate that we are giving to the patient. Okay, so here the carbohydrate intake is given as of 60% of the total energy required, and complex carbohydrate are accepted to be given to the patient. We don't give simple carbohydrates. For example, we don't give juices, we don't give sugar, we don't give jaggery and all those things. We provide them with whole wheat, and then we give them parboiled rice. Okay, roti is more favorable than rice here again. So these are some basic type of carbohydrate less food which we give to the patient. So going on to foods that which are avoided to a diabetic patient, we avoid heavy sugar laden foods such as candy, soft drinks, dessert, cookies, syrup, honey, condensed milk, sugar gum, jams, and jellies, which I've already said. New trend is to count only carbs, as blood sugar levels are most affected by carbs, and patient then takes an amount of insulin based upon the amount of carbs that is to be eaten. Okay, so as said earlier, we need to limit the amount of carbohydrate that is being given to the patient. So that is what the slide is saying as well. So next we move on to calorie control diet or low calorie diet. These are given to patient who have overweight problem, or patient who are obese, sort of weight management diet actually. Avoid or limit high calorie foods such as butter, cream, whole milk, cream soups or gravy, sweet soft drinks, alcohol beverage, salad dressings, fatty meals, candy, and rich dessert. The reason here why we are avoiding all these are because they contain a high amount of fats, mostly saturated fatty acids, which are again very harmful to your body because it does not get digested in the body, and it has a very adverse effect to your health. Okay, so we tend to you need to limit on those kind of food. Next, moving to low cholesterol diet. Here we need to restrict food containing cholesterol, which is your red meats. Okay, used for patient with atherosclerosis and heart diseases. I hope we already know what is the meaning of atherosclerosis. And limit food high in saturated fats such as beef, liver, pork, lamb, egg yolk, cream cheese, natural cheese, shellfish, whole milk, and coconut and palm oil products. I hope we all know that what happens with when cholesterol is high in your blood. So I guess we don't have to discuss like what does high cholesterol do to your body. Okay, so basically the atherosclerosis mentioned here, it is a type of disease which is as a result of high cholesterol in your blood. So you can all look it up. Moving on to fat restricted or low fat diet. These are used for patients with gallbladder and liver disease, obesity, and certain heart diseases. We avoid cream, whole milk, cheese, fats, fatty meats, rich desserts, chocolate, fried food, salad dressing, nuts, and coconut. People suffering from fatty liver, obesity, and heart diseases, and also gallbladder, they tend to eat, or they should eat low fat diet in their food, because the excess amount of fat is very difficult to get metabolized in the body, and if we give them a high fat food, then the more amount of fat that we give, it will not get metabolized and it will cause more harm to their existing diseases. Next, we move on to sodium restricted diet or low sodium or low salt diet. These are for patients with cardiovascular diseases such as hypertension or congestive heart disease, kidney disease, and edema. Okay, so if you have more amount of sodium in your body, then you result to edema, which means the inflammation of body due to the water retention in your body, which is a result of high sodium content in your body. So in order to avoid those, we limit the addition of salt to any food. We limit the intake of smoked meat or fish, processed foods, pickles, olives, and processed cheese. Okay, so now we move on to high protein diet. The high protein diet are used for children and adolescents who need additional growth, pregnant or lactating mom or women before and or after surgery, patients suffering from burns, fevers, or infection, because as discussed already, because they are having catabolic reaction in their body. Okay, so in order to neutralize this catabolic reaction, we need to provide them with enough carbohydrate and protein in order to as to replenish the energy and the protein loss. Regular diet with added protein rich foods such as meat, fish, milk, cheese, and also eggs. Okay, because eggs are high in protein. Low protein diet are used for patients with certain kidney diseases and for certain allergic conditions. Regular diet with limited or decreased protein rich food. Okay. Next, we go on to bland diet. They consist of easily digestible food that do not irritate the digestive tract, used for patients with ulcers and other digestive diseases. Avoid coarse food, fried foods, high seasonal foods, pastries, raw fruits, veggies, alcohol, carbonated beverages, nuts, coffee, tea, smoke, and salted meats and fish. These are all because they have a high content of sodium, high content of complex carbohydrate, which results to a high fiber in the diet. Next, we have low residue diet. These are used for patients with digestive and rectal diseases such as colitis or diarrhea. Eliminates or limit foods high in bulk or fibers such as raw fruits and vegetables, whole grains and cereals, nuts, seeds, beans and peas, coconut and fried food. Okay, this should be restricted in the body. Now moving on to some special diets. These are, besides the therapeutic diets, these are also therapeutic diets which come under the heading of some special diets. Now we have high fiber diets, gluten free diet and elimination diets. Okay, elimination diets and exclusion diets. So in brief we will be discussing them. High fiber diets. The patient are advised to eat high fiber cereals as whole grain, flour or bread, whole grain breakfast cereal, whole wheat pasta and brown rice, and kinds of fruits and vegetables with their edible peels. Unprocessed bran can also be added to cereals or soups to give more fiber. So basically it is giving more of the roughage to the body. Next is the gluten-free diet. It is a diet recommended for the patients with gluten enteropathy. Gluten is present in wheat, the barley, oats. Thus, foods containing this should not be eaten. A number of gluten-free products are available on prescription, and these include gluten-free flour, bread, biscuits, also almond flour. Okay. So basically you can also use gluten-free diet when you have celiac disease as well. Next is your elimination diet. This type of diet is used in patients with suspected food intolerance, food allergies or Crohn's disease. Yeah, this is when you don't know what particular food might be intolerable to the patient, so you give this type of diet. Exclusion diet. Specific dietary exclusion becomes a necessity in case of food allergy or food intolerance. The therapeutic use of such diets requires a detailed discussion between the patient and the dietitian. Each patient is provided with a list of foods that are permissible and avoided. Also, the need to scrutinize the ingredient list in all convenience and manufacture goods in emphasis. For example, you may tell Johnson's disease also, okay, and Wilson disease. So these are few examples of diseases in which the exclusion diets might be used. The examples of this diet include wheat-free diet. Foods to be avoided are ordinary breads, biscuits, cakes, pastries, pasta, spaghetti, and all wheat-containing breakfast cereal. Next, we have milk-free diet. As the name implies, all foods containing milk milk free has to be milk free. Okay, containing milk protein must be avoided, such as cheese, yogurt, ice cream, butter. So the protein casein is basically avoided in this milk-free diet. Next is your egg-free diet. In this, eggs and all products containing eggs are excluded from the diet, such as beef burgers, pies, cakes, meringues, Bonvita, Ovaltine. As egg also might cause some food allergy to certain patient. Next, under some special diets, we have additive-free diets. Here, additive include permitted food colors such as tartazine, sunset yellow, Ponce's 4R, and preservatives such as benzoic acid, salicylate, etc. are excluded from the diet. Some people also suffer allergy from the additives that are industrial additives that are actually added to the food. So these are better avoided to certain patients. Next, we have ketogenic diet. It is usually to facilitate the control of epilepsy. This was the sole reason why ketogenic diet was introduced, basically. Here the patient is initially fasted for 48 hours and thereafter half the energy requirements is provided as MCT. Okay, so it is basically a very high fat diet which contains your MCT or medium chain triglycerides. Energy intake from ordinary food must be restricted to prevent the suppression of ketones. So the ketones that are coming after the metabolism should be accessible by the patient, because that is the demand of the particular patient suffering from epilepsy. Okay, so next we go on to mode of feeding. So here we have oral feeding, tube or enteral feeding, peripheral vein feeding, total parenteral feeding. This we will also discuss in our next chapter, which is adaptation, medical nutrition in critical care. Okay, so here we just go through what this term means. Mode of feeding. The diet of an individual could be managed by using oral, tube, peripheral vein or total parenteral feeding as per patient physical condition. The dietitian should understand the limitation of the patient and enlist the help of nurse or patient relative. These are the types of feeding as discussed. Next, we discuss in brief oral feeding. This is preferred and most palatable method of feeding for meeting the increased nutritional demands of catabolism. It should be used as long as possible if needed nutrient supplements added to the oral diet. So oral feed basically means having food from your mouth. Okay. So this is the most favorable feeding as any other feeding types of feeding. So number 2, we have tube or enteral feeding. Ideally, the patient must be fed orally, but in case when the patient is unable to take solid food, a part or all of the intake is usually given by the tube. These are the cases where the gastrointestinal tract is functioning and can be used. Here, an alternate form of enteral feeding by tube provides the nutritional support. Enteral nutrition can be provided by supplying intact, semi or completely hydrolyzed formulas through nasogastric, duodenal, jejunal routes, or by the help of gastrotomies or jejunostomies. These conditions include oral surgery, gastrointestinal surgery, dysphagia, unconsciousness, anorexia or esophageal obstruction, or various commercial formulas are available for enteral tube feeding. So, when a patient is suffering from surgery, gastrointestinal surgery, dysphagia, unconsciousness, anorexia, esophageal obstruction, these are the reasons why a patient should be undergoing tube feeding. Next type of feeding is your peripheral vein feeding. Intravenous feeding is a method of providing parenteral nutrition when a patient cannot take in food or formula through the gastrointestinal tract. Let me remind you here, the patient is also not able to take his food orally. Okay. Various solution of dextrose, amino acids, vitamins, minerals and lipids, which means the nutrients are in their simplest form. Okay, they are fed through the peripheral veins. But in this method, the nutrient and kilocalorie intake is limited. It is very limited. It is used only when the nutritional need is not extensive and long term. Again, the peripheral vein feeding is not a long term process. It is only utilized when it is very extensive. That means all types of feeding conditions to the patient has been failed or it is not eligible to the patient right now. It is only used when the nutritional need is not extensive and long term as stated earlier. Whether it is provided peripherally as a mixture of 5 to 10% glucose or 3.5 to 5% of amino acid solution and 10 to 20% of lipid emulsions. Okay, glucose for carbohydrate, amino acid solution for protein and 10 to 20% of lipid emulsion for fats. The total fat intake should not be exceed 2.5 gram per kg per day. Vitamin, minerals and electrolytes are added as necessary based on requirement and intake. Okay, so when we are giving peripheral vein feeding, it is always in terms, the feed should be expressed or the feed The osmolarity of the feed is calculated, and the osmolarity of the solution should not be greater than 600 MOSM per liter. The osmolarity can also increase to 900 MOSML per liter. Okay, but in between 600 to 900 milliosmol of solute per liter, the osmolarity of the solution should remain and it should not exceed beyond that.